This is the case of complete heart block in case of neonate, and baby is on second day of life. You can see the flow across aorta, and ventricular rate is only 44 beats per minute. You can see in this image here calculated the ventricular rate is only 44 beats per minute. So it is always likely that this baby has got, this neonate he has got complete heart block, and complete heart block is quite a rare finding in case of neonate. Mostly seen in case of mother who is having SLE or some other autoimmune connective tissue disorder or diabetes. In case of mother has diabetes, baby is likely to have complete heart block, though it is very rare. So in this case, what we see, this ventricular rate is only 44 beats per minute. Baby is on the second day of life. So the case is having complete heart block. You can see this is ventricular rate, only 44 beats per minute. So if you want to calculate, then just calculate. See, this is here, this is here. Again, it shows ventricular rate, heart rate. This is just see. The rate is only 45 beats per minute. You can see here, it is only 45 beats per minute. So it is the case likely that is having complete heart block. Normally, in case of adult, we usually see what when the heart rate is less than 40, ventricular rate is less than 40, that you see across pulmonary artery or aorta. So that is the likely to have complete heart block. In case of neonate, if it rate is less than 60, it is likely to have complete heart block. So in this case, the baby is neonate has having complete heart block. At the same time, this baby also had persistent pulmonary hypertension of newborn. You can see the flow across pulmonary wall. This is pulmonary registration jet, and this velocity is pulmonary artery and diastolic velocity. You see the end diastolic velocity 2.7 meter per second, and peak gradient is 31. And diastolic gradient 31 millimeter of mercury. So whenever you see the end diastolic gradient more than 16 or velocity more than 2 meter per second, the case is likely to have severe pulmonary artery hypertension. This is pulmonary registration jet, and you see this is the peak velocity, this is the end diastolic velocity. The peak velocity is the maximum velocity, and diastolic velocity means at the end of diastole, the highest velocity that you record. This is the end diastolic velocity, and that velocity is more than 2 meter per second. That means case is likely to have severe pulmonary artery hypertension. So this baby has also severe pulmonary artery hypertension. This baby has not even completed 24 hours of life. Baby is on second day. So in case is having complete heart block and persistent pulmonary hypertension of newborn. Next image, you can see this is D-shaped heart. See, in this image, what you see, this patent ductus arteriosus. Image by this is left atrium. This is aorta. AO means aorta. This is main pulmonary artery or pulmonary trunk. This is right pulmonary artery. This is left pulmonary artery, and this is PDA. So whenever you have to find out whether PDA is present, from right to left, first will be the right pulmonary artery branch, second will be left pulmonary artery branch, and third will be patent ductus arteriosus. You can see here the patent ductus arteriosus having flow, bidirectional flow. Whenever you see the red color, you see the red in color. Wherever this is forward flow, red in color. Red in color means flow from aorta into pulmonary artery. You can see in this image right atrium and right ventricle. This is right atrium, this is right ventricle, severely dilated. Global hypokinesia of left ventricle and right ventricle also. The right ventricle is more affected compared to left ventricle in relation to global hypokinesia. So right ventricle is more hypokinetic compared to left ventricle. Can you see the D-shaped left ventricle? So this is the case of persistent pulmonary hypertension of newborn, a small patent ductus arteriosus with bidirectional flow, and complete heart block and cardiomyopathy. Thank you.